Cancer Risk, Control What You Can. Brought to you by Excellus Blue Cross Blue Shield. Most of us have been impacted by cancer in some way, either through a personal diagnosis or the diagnosis of a friend, coworker, or family member. While not all cancers can be prevented, this presentation will provide an overview of the disease of cancer, explain risk factors, focus on things you can do to help minimize your risk for some cancers, and explain how screening tests can help detect some common cancers early when they are most treatable. First, let's get a basic understanding of how cancer is defined. Cancer cells are cells that have damaged DNA. That damage could be inherited or caused by other factors. Cancer is always named for the organ or tissue where it originated, even if it spreads to other parts of the body. When cancer spreads to another part of the body, it is said to have metastasized. So, for example, someone diagnosed with metastatic breast cancer has cancer that started in the breast tissue and has spread to other parts of the body. When cancer is first diagnosed, it is labeled with a stage number 1 through 4. Stage 1 cancer describes cancer that is relatively small and has not spread out of the original organ or tissue. Higher stages indicate that the cancer tumor is larger or has spread to another place in the body. Different types of cancer can behave very differently. For example, lung cancer and breast cancer are very different diseases. They grow at different rates and respond to different treatments. That is why people with cancer need treatment that is aimed at their particular kind of cancer. Everyone is at risk for developing cancer. Cancer risk increases for both men and women as they age. According to the American Cancer Society, about 78% of all cancers are diagnosed in people 55 years and older. However, it is important to know that there are things we can do to both understand and minimize personal risks for cancer. There are some risk factors that we cannot change. These uncontrollable risk factors include age, gender, and family history. Some risk factors are within our control. Lifestyle issues such as smoking, being sedentary, and poor diet contribute to about 2/3 of cancer incidence. A history of unprotected sun exposure can lead to skin cancer later in life. In 1982, the United States Surgeon General's report stated that cigarette smoking is the major single cause of cancer mortality in the United States. This statement is as true today as it was then. Cigarette smoking accounts for at least 30% of all cancer deaths. It is a major cause of cancers of the lung, mouth, throat, and bladder, and is a contributing cause in the development of cancers of the pancreas, cervix, kidney, stomach, and some leukemias. For people who want to quit smoking, there are many resources, such as medications and telephone quit lines, that can help them be successful. Not using tobacco is a significant way to reduce cancer risk. Diet and exercise play a role in reducing cancer risk. Nutrient-dense foods, such as fruits, vegetables, and whole grains, provide vitamins, minerals, antioxidants, and other substances that work together to lower risks of many cancers. Aim for at least 5 cups of colorful fruits and vegetables daily, and 3 servings of whole grains. Limiting red meat like beef, pork, and lamb, as well as processed meats such as hot dogs, deli meat, and bacon, can help reduce the risk of colon and prostate cancers. Eating a plant-based, low-fat diet can help maintain a healthy weight, also important in lowering risk for cancer. Sun exposure adds up day after day, and it happens every time you are in the sun. It is important to protect yourself from sun exposure every day by using sunscreen and wearing protective clothing, hats, and sunglasses. Because sun exposure adds up over a lifetime, it is important to protect children from the sun and to teach them good habits, including the avoidance of indoor tanning beds and lamps. Screening tests are done at regular intervals when you don't have symptoms. Over time, those tests can show changes that could be cancer. When cancer is detected early, there are more treatment options and increased chances of survival. Cancers detected at later stages may have spread to other organs and may need more aggressive treatment. Not all cancers have effective screening tests available. Screening tests are available for breast, cervical, colon, and prostate cancers. All adults, regardless of family history or lifestyle, should get screening tests according to the recommendations for their age and gender. People with increased risks for cancer, family history of cancer, smoking, or previous cancer may need to be screened at a younger age or at more frequent intervals. It is important to discuss this with your primary care physician to determine what is appropriate for you. Mammograms, an X-ray image of the breast tissue, are recommended at regular intervals for all women. This test can show a change in the breast tissue that may be cancer long before it can be felt. Regular mammograms allow the doctor to spot changes and recommend appropriate follow-up. It is important for a woman to begin having the conversation with her doctor at age 40 to determine the most appropriate screening intervals for her. Women with a family history of breast or ovarian cancer should talk to their doctors about the age and frequency of mammograms or other testing. In addition to regular mammograms, a clinical breast exam done as part of a routine physical or gynecological exam is recommended. Women should know how their breasts normally look and feel and report any breast change promptly to their healthcare provider. Breast self-exam is an option for women starting in their 20s. Cervical cancer screening is done by a Pap test as part of a routine gynecological exam. Talk to your doctor about your personal history and follow recommendations for appropriate screening intervals. Beginning at age 50, both men and women should begin colon cancer screening. A colonoscopy can find and remove polyps, which could become cancerous. This test is performed in a hospital or medical office setting and is done every 5 to 10 years. All men should talk with their doctors about the risks and benefits of prostate cancer screening. Because of their higher risk, African American men and men with a family history of cancer should begin the conversation with their doctors by age 45. For the general population, prostate cancer screening decisions should be made starting at age 50. Currently, there are no routine screening tests for lung cancer. Close to 90% of lung cancers are caused by smoking and exposure to secondhand smoke. The best way to reduce lung cancer risk is to avoid smoking. In this presentation, we looked at some of the choices we have in reducing risks for cancer. These include avoiding tobacco use, eating a healthy diet, and the regular use of sunscreen. An understanding of personal history can help when making decisions about cancer screening tests and the intervals they should be repeated. Regular cancer screening tests are recommended and are based on gender, age, and risk factors. The earlier an existing cancer is detected, the more likely it can be treated or cured. In addition, it is important to be aware of any changes in your body or the way you feel and report those changes to your healthcare provider. While most symptoms are not cancer, it is always important to take charge of your own health and seek medical treatment as soon as possible when you don't feel well.